feels like you're standing next to an open oven. I mean, even like last night walking home and it's dark, you can feel the heat coming from the road.
Our planet has a problem. It's killing more of us seemingly than ever before.
We are very concerned that we're going to see a lot of children losing their lives.
Nothing is deadlier than the heat.
These are preventable deaths.
Deaths doubling in just the past generation. It's stunning, but also likely a severe undercounting.
If you were to go right there where the sun is, it'd be killer.
Now, on this episode of Scripps News Reports, medical professionals retraining on how to save lives, climate experts on whether this can be reversed, and what all of this means for all of us. This is Scripps News Reports, Death by Heat. I'm James Packard in Los Angeles, where nearby cities started the month of September with temperatures topping 110 degrees Fahrenheit. This is a trend here, a deadly one. Nearly half of the country's heat deaths occur in this part of the country, specifically California, Arizona, Nevada, and Texas. We seem to be crowning a new hottest year on record every single year. It's so bad even medical professionals are having to get new training on how to save lives, as Thomas Hoppo reports.
So our program is really focused on trying to scale up a climate-savvy healthcare workforce.
Dr. Jay Lemery is a University of Colorado med school professor in emergency medicine, and lately he's been thinking a lot about the health of the planet.
When we think about climate change and how it affects our health, right, there's so many different things.
As the co-director of the University of Colorado's Climate and Health program, Lemery says medical professionals need to understand what's happening to the environment and how that might be affecting their patients.
Those extreme heat events can absolutely kill. We're going to be seeing warmer heat events and more frequently, and I think that is in the increasing years will be one of the worst scenarios.
Lemery is among the scientists and health experts across the world saying that climate change is directly affecting our health. The World Health Organization reports that the changes present a fundamental threat to humans, from extreme heat and wildfires to severe storms and hurricanes. The organization reports that 3.6 billion people already live in areas highly susceptible to climate change. And between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year. But there is a divide. According to a joint report by Yale and George Mason universities, only 52% of Americans think extreme weather poses a high or moderate risk to their community over the next 10 years.
As the world gets warmer, we're seeing stronger storms, rising seas, more immigration problems because crop failures, and health issues. Diseases that would not be in certain areas are moving toward the poles because of a warmer world.
Which is why part of the program is to better educate the public and work with broadcast meteorologists to get the word out about the dangers of climate change.
Television meteorologists have a unique ability and I think responsibility to talk about climate change.
Mike Nelson is the chief meteorologist at the Scripps own Denver 7.
The trust bridge is important because we can teach our viewers about the impact of climate change on all aspects of life and health.
It's a responsibility that goes beyond telling viewers if they'll need an umbrella tomorrow.
In a warmer world, people that have respiratory problems are going to have more trouble. Kids that have asthma are going to have more problems, and diseases are going to spread more rapidly. So all of that is related to climate and health.
And Thomas joins us now from Denver, which hit 102 degrees in early August, 3 degrees shy, Thomas, of the hottest temperature ever recorded there in Denver. And you have found it's not just this extreme heat that's posing a threat to human health.
No, it's not just the extreme heat, but it is related to heat when it comes to food and the food supply and food shortages. I think the World Health Organization reported that there's 770 million people that suffer from hunger as a due to shortage of food. That's primarily in Africa and Asia, but also the heat affects the water supply and affects the water safety. When it gets hotter, that could heat up the water, and the water can actually be unsafe for people to drink, unsafe for people to use, and growing algae. But the heat can also affect the diseases and spread disease even more, with mosquitoes being in places that they're not used to being in, and spreading around West Nile virus and malaria.
Thomas Hoppe in Denver for us with this new training for medical professionals. Thomas, thank you very much. At least 21,000 people have died in the United States from heat since 1999, and that appears to be a vast undercounting. Let's dig in. Craig Fugate was President Obama's FEMA administrator, the Federal Emergency Management Agency. He organized responses to 87 disasters in 2011. And Dr. David Sklar is an emergency physician and associate dean and professor at Arizona State University. Dr. Sklar, I want to start with you. We focus so much on the big storms, the big weather stories here, tornadoes, hurricanes, that kind of thing. The reality is heat is the biggest weather killer. Why is that?
Well, heat goes for a long period of time. So a lot of the disasters that we're accustomed to come and then they go, and a few people are injured or sometimes become sick. But heat, particularly over this past few years in places like Phoenix, where I work, can go on for days and weeks and months. In fact, we've just had 100 days where the temperature was over 100 degrees in Phoenix. And after a while, the effects of the heat become more cumulative. And people, particularly with chronic diseases, have difficulty being able to cope with that heat. So if you have chronic heart failure, renal failure, problems like that, you have difficulty being able to sustain just the normal way of behaving in your home. And then if your home has problems with air conditioning, that will exacerbate it. And then if you, unfortunately, don't have a good place to live, so if you're homeless and you have to survive mostly outdoors and you're not protected, that will also add to your risk.
Yeah, it's so important that we see cities like Los Angeles setting up cooling centers on really hot days like this, because it can sneak up on you. And Mr. Fugate, I'm curious, because so often we talk about emergency response in the short term, a big storm, a flooding event, something like that. This is, it comes in heat waves, yes, but a longer term thing. How do you coordinate a response to something that is so long term and getting worse over the long term?
Well, part of this goes back to emphasizing heat as one of the hazards communities face. This is in FEMA's planning guidance. It goes back really to the 90s when we saw a deadly heat wave strike Chicago. And it became evident that both from the National Weather Service, providing better products to advise people on the heat risk, but also the preparedness message, and including things as the doctor pointed out, cities opening up cooling shelters and having certain thresholds when they increase services to the most vulnerable populations. So while most people don't see FEMA responding to heat emergencies, this has been something that emergency managers have been building into their plans for some time. And we're now seeing more and more of these events occurring. So I think it's, again, as you point out, this is not the disaster that occurs where a tornado touches down and you respond in and bring all the resources and you're done. This is an accumulative effect. And that's why it's so important communities plan for these events, not as one-offs, but as something that can be, as we saw in Phoenix, something that could be a summer-long event.
It's just stunning when you see those high temperatures one day after another listed so high. Craig, I am curious from your perspective, you have been described by former Florida Governor Jeb Bush as the best emergency manager in the country. Former President Barack Obama kept you in that FEMA job for his entire tenure. That is a Republican and a Democrat agreeing that you're the best at this. And when we're talking about emergencies, politics shouldn't matter, but when it comes to our climate change discussions, it so often does. How do you break through that?
Well, I think you really got, two conversations going on. What's causing climate change and then how we're going to adapt to it. And I think President Obama, it was during the response to Superstorm Sandy, said, we need to quit talking about debating climate change. We need to start figuring out what we're going to do differently and adapt. So whichever side of the debate you're on, you can't argue these record-setting temperatures. And so what are you going to do differently? And I think that's the conversation that emergency managers are trying to get people to focus on, is doing what we've always done will not continue to work. Where we build, how we adapt to these changes. We're used to talking about the Sun Belt for extreme temperatures, but where we see tremendous problems is in parts of the country that don't usually have air conditioning. They have a much milder climate. When they start seeing temperatures in 100 degrees, they have very little coping mechanisms. And those populations are extremely vulnerable. So I think we've got to really get past this debate about what's causing climate change, understand it's happening, and we know why, and talk about how we're going to adapt our communities. Because I like to tell people, the climate changes with a D. It's already changed. And our communities weren't built for this. Our infrastructure wasn't built for it. And a lot of underlying societal issues are not adapting to it. And unless we change, our death tolls will continue to increase, and extreme temperature will continue to be one of the leading causes of death in weather-related hazards.
So, Dr. Sklar, then, on an individual level, what behavior should we change? How should we respond, bottom line, to more extreme heat?
Well, first of all, you need to be aware of the risks, particularly if you have any kind of chronic conditions. Stay indoors as much as possible, and hopefully in places where you do have air conditioning. And then if you do need to go out, make sure you always take some water with you. We always tell people, if they're even driving in an air-conditioned car, you never know if that car will break down and you'll have to get out and get help. So make sure and take some bottles of water with you. And then be aware of some of the early symptoms, headache and feeling as if you may pass out. A lot of times people will get muscle cramps. And in the emergency department, we're seeing people at all of those levels. We see them at the minor levels where they're having cramps, at the higher levels where their blood pressure is sometimes already dropping, and they're having headaches and even nausea. And then at the most severe levels, where they are starting to become unconscious or are fully unconscious and vomiting and having other severe symptoms, and their own temperatures have now risen to the level of 108 or 109 or 110. Those are the people that we have to actually plunge into a ice water bath and cool off very rapidly. And in fact, our EMS folks have now started to do that in Phoenix. So we now are instituting cooling measures before the patients even come to the emergency department, which is really something new that we've instituted this year. And I think it's making a difference, but we'd really love to be able to prevent it from happening rather than having to treat it after it happens.
Dr. David Sklar, Craig Fugate, former FEMA administrator, thank you both very much for being here. I appreciate your perspective.
Thank you.
Thank you.
Coming up for us, a meeting of the minds, the meteorological minds. Can any of these trends be reversed?
For me, it's unbearable.
It's hard for me to breathe.
We have seen a record level of heat-related deaths.
I think it's a matter of urgency because we have so many vulnerable people.
I've lost 4 friends.
Wow.
And it's all been in less than a couple of months.
These are preventable deaths.
If you have anyone in your life born in the past 25 years, I want you to consider a stone-cold fact about heat. Heat-related deaths have doubled in that time in the United States, 2,300 people last year alone. This is a trend we're all too familiar with by now, but one question we haven't answered yet is whether we can do anything about it. Let's introduce our panel. If you know Scripps News, you know this guy. He's our meteorologist, Scott Withers. You know him well. And then there's Jen Brady, Climate Central. She leads Climate Central's data investigations into climate trends. Thank you both for being here. Scotty, I want to start with you. Why do we keep breaking these heat records? They are deadly.
James, 2 words, climate change. Before we get to that, because I know that's always controversial, I just want to explain what a heat wave is. It's a high pressure system. Here's the thing. Since the planet has had an atmosphere, we've had high pressure systems. So those are not new. It's an area where literally the weight of the air is so heavy, it's keeping the heat trapped down on the ground, and that just intensifies as more solar energy comes down from the sun. Totally normal. This should happen in our atmosphere. What's changed, though, with climate change is we have more of those. When we burn more fossil fuels, we have more of those greenhouse gases up in the atmosphere. They trap even more heat, so you're adding that on top of the traditional heat from the heat wave, and you're marrying those together. So what's happening is climate change does not create a heat wave or a heat dome. It intensifies and expands the length of the heat wave or the heat dome.
And Jen, we have been citing stats from this study that was published in the American Medical Association's science journal, JAMA. It has found a steep upswing in heat-related deaths since 2016. You make a living studying data. What's been going on since 2016?
Well, really, it's been before 2016 even. We've seen a steady increase in the temperatures, particularly extreme temperatures. Another thing that often doesn't get talked about are nighttime temperatures, which can be very dangerous when you don't have time to recover. We've seen a very strong increase in nighttime temperatures as well, and often people don't notice that.
Scott, you often are on our air giving forecasts for a couple of days out, maybe a week out, as is your job and what we see meteorologists doing so often. But what do these longer term changes, climate change, what does that do to the forecast that you put out in the short term?
Yeah, it makes our forecast a little bit harder to project. When we do a forecast, we actually are taking current data and we're marrying it with what's happened in the past because we know what's happened. We've got 100-year plus of data. So we can look at a locale and say, oh, this is what's happened in the past in a similar situation when we've had these parameters. But now what's happening is we can't really adjust for that because climate change has changed everything. It's made the sea surface temperatures hotter. That influences the winds and makes storms rapidly intensify. That didn't happen in the past. And then, of course, warmer air means that more moisture is trapped in there. So now you're getting more flooding events and storms are slowing down. So they're training over the same place. And that's why we keep seeing these massive flash flooding events. So it has changed the way that we can do forecasts. It's made it harder to pinpoint some of those really severe issues that we try and keep everyone aware of before so they're prepared.
And Scotty, you are on our air talking about climate change all the time and contextualizing it in terms of the weather that we're seeing. But in the past, a lot of meteorologists have been hesitant to talk about climate change because it's so politically loaded. That seems to be eroding now. Studies have shown that meteorologists are the most trusted to talk about climate change. From your perspective, what's the responsibility that you and your colleagues have to talk about climate change and how it's changing our weather?
So let's just be honest here. 95% of all real and legitimate scientists know that climate change is real. So when you're hearing, oh, it's controversial, it's political, it is just political. The facts are the facts. This is happening. You can see it in the sea surface temperatures, in the rainfall, and the intensity of storms. So I think we are past the point of saying, oh, it's political, I'm not talking about it, I'm a meteorologist. I am going to give you the facts 100% of the time because all of the data supports exactly what I'm saying. Those are the facts. If people want to play politics around it, that's up for them. I and other meteorologists, we're just giving you the facts because we know so many people's lives are in danger now and going forward.
And Jen, as you hear Scotty alluding to, this is regional too. I mean, what changes are you seeing in terms of how our weather patterns are changing? Because we talked about heat-related deaths every year. Half of them are in California and the Southwest.
Yeah, we're seeing different changes at different times of year. The Southwest, unfortunately, is seeing a large increase in heat year-round. A lot of areas, the upper Midwest and the plains, the heat is coming more in the winter time. That's when they're seeing the largest increase in temperatures. So they're losing recreational sports that they love, like ice fishing and outdoor ice hockey. So you're seeing larger temperatures there in the winter. So it really does vary from region to region, as does the rainfall pattern. Some places are seeing drought because of this heat. Some places are seeing increased rainfall and flooding because of this heat. We really do have a diverse country in that way about weather patterns, but climate change is infecting all of it.
Jen, is any of this reversible?
Yes, it is. There's some that's locked in. We do have gases in the air that are going to live there for a while. We are seeing some change. We are seeing some people, finding solutions, implementing solutions. We have some wonderful technological solutions and just everyday behaviors we can do. We can change it. It's going to take a while and it's going to be out a while, but there's no reason to lose hope and just say we're just going to throw up our hands and not even try.
And Scotty, looking ahead, we've talked about those heat-related deaths doubling in America in less than a generation. What's it looking like for the next generation?
Not good, just to be honest. It's going to continue intensifying because one thing that you're just talking about is summer is getting longer and longer, and it's encroaching. Spring and fall are getting shorter. That means we have a larger number of hot days. And as we said earlier, we also have hot nights. It's got to be below 72 so the body can regenerate itself and actually get to a good position. If it's not, you don't get enough downtime before the next hot day. So as these continue and keep spreading, it's going to cause more problems, especially for senior citizens and in areas like the Pacific Northwest, where we just don't have the infrastructure of air conditioning in lots of homes and businesses, because in the past they didn't need it other than a few days a year. Now they need it a much longer.
And to reiterate what Jen said, it doesn't mean that we should throw up our hands and think there's no hope, because there is work we can do to avert worse and worse results. Scott Withers, Jen Brady of Climate Central, I thank you both. And we are back with some final thoughts here in just a moment. Back now from California, where it has been hotter more frequently for longer, killing more people. Here in Los Angeles, like in so many cities across the country, it is the biggest climate threat. Heat sends more people to the hospital and to their graves than any other extreme weather event. We have lost more than 21,000 people in this country to heat since 1999, according to that JAMA study. Our neighbors, our family, baking to death as extreme heat builds and gets worse every year. We've shown you how even doctors are having to retrain in climate medicine. As the experts figure out the path ahead, plan for your own. How will you prepare yourself and your loved ones for the heat to come? Plan now. For Scripps News Reports, I'm James Packard in Los Angeles.